Welcome to Integrated Medicine Perspective. I'm Dr. Wendy Liu. Every year, we go to our primary care physician for physical and blood work. As we age, the list of tests expands, including mammograms, prostate exam, and colonoscopies. While these regular checkups fall under the category of preventative healthcare, it's more accurate to see them as early diagnostic measures rather than effective disease prevention. Let's take mammograms as an example. They help detect breast cancer early, but can they actually prevent its occurrence? Obviously not. Mammograms do not correct the root causes of breast cancer. As a matter of fact, the history of breast cancer itself is one of the risk factors for its development. So this tells us that mammograms and early treatment alone do not eliminate the underlying causes of breast cancer. So what are the risk factors for breast cancer? Genetics, family history, age, early onset of menstruation before 12, late menopause after 55, high breast density, hormone replacement therapy, late pregnancies, lack of exercise, obesity, alcohol consumption, and a previous history of breast cancer. These are the factors listed by the CDC. But I think we should also consider lack of sun exposure as one of the risk factors. Obviously, genetics, age, and family history are factors beyond our control, but other factors can be changed to some extent. Obesity, for instance, including childhood obesity, needs proactive prevention and correction because childhood obesity is related to early menstruation. Central obesity, excess abdominal fat, is not only a risk factor for the development of breast cancer, but also a risk factor associated with more aggressive pathology and higher mortality rate. One of the mechanisms behind obesity as one of the risk factors for breast cancer is insulin resistance. Elevated insulin levels increase estrogen utilization, which is unfavorable for the development and prognosis of breast cancer. Accumulation of abdominal fat reflects insulin resistance much more than body mass index. Weight loss should aim at correcting insulin resistance rather than merely reducing body weight. If we use medications for weight loss, we should learn if their actions can actually correct insulin resistance. Improving risk factors that contribute to diseases is a genuine preventative measure and should be the first and the most important line of defense in disease prevention. Regular disease screening cannot change any risk factors for disease development. Mammograms, for instance, cannot alter obesity. Therefore, regular disease screening can only serve as the second line of defense in disease prevention, not the primary one. However, in actual practice, regular disease screening is often mistakenly treated as the primary line of defense. Without risk factor mitigation, disease prevention would be an empty line. Mammograms do not reduce breast cancer occurrence, neither do they reduce breast cancer mortality rate. Improving risk factors for diseases is truly challenging. One crucial reason is that lifestyle habits are not easy to change. Another significant reason is that regular disease screening is not the best feedback method for individuals' disease prevention efforts. Annual checkups often show negative results, which are great, but do not offer clear feedbacks for further actions or modifications of preventative measures. On the other hand, negative results may lead to a sense of complacency, allowing individuals to continue bad lifestyle habits. To address this in practice, we can convert the improvement of disease risk factors into easily observable indicators as our feedback. For instance, exercising can reduce the risk for cancer, diabetes, and cardiovascular diseases, so we can set clear indicators for exercise, such as a certain level of fitness, being able to walk a mile in 20 minutes and chat with a friend at the same time. Such a level of fitness indicates good heart and lung function and serves as easily observable feedback for the effectiveness of our exercise regimen. We can tailor such indicators based on individuals' health status and the disease risk factors. I cannot stress enough the importance of individualization. For instance, the fitness level I mentioned earlier is not suitable for elderly individuals with high fall risks. It is essential to recognize that one size does not fit all. When we can achieve an optimal level in nutritional, physical, and emotional fitness, we can achieve the goal of disease prevention. Improving risk factors is a protective barrier in disease prevention. If this barrier is not sturdy, regular checkups and localized, probably even frequent repairs, won't make it strong. If our first line of prevention is robust, then regular disease screening can truly play a role in preventing problems before they escalate. That's all for today's discussion. Please leave comments and questions. I will see you next time.